Amal came for doing her nose. She has been looking for a lot of surgeons. I saw Amal, and her nose is actually a tough nose, relatively speaking, when you talk about rhinoplasty, because her problem was mainly in the tip. She has a bulky tip with overdeveloped lower cartilages, and the tip was not in harmony with the rest of the face. See, and I explained everything with Amal that rhinoplasty is the hardest procedure a plastic surgeon does. That is why there's a lot of revisions in rhinoplasty. And that is why it's very important for the patients to do their homework, their research, and go with somebody who does a lot of nose surgeries. In her case, it's very important to realize that what we're trying to do is make the nose fit the rest of the face. That creates balance and harmony between the structures of the face. And we're not trying to get a beautiful nose, we're trying to make a nose that complements the other features. And the most common problems that other plastic surgeons do is try to make a beautiful nose and it looks overdone. And that's where the problem is. I explained the risks involved in here and the difficulty level of her nose, considering the fact that mainly we're working around the tip and the bulkiness of the nose. And the issue with her is that we didn't want the structure of the nose and what I'm doing for her to affect her singing voice ability. Amal is a very famous singer, and she was concerned that this surgery is not going to affect her voice and the function of her breathing through the nose. So we discussed all the aspects of the procedure, and the healing process is very important because besides the fact that the surgeon has to have the artistic eye of what he's trying to do aesthetically, you also have to maintain the function of the nose. So we discussed everything in detail. I went over pictures, I went over the procedure without 3D animation that we have on our website, and we used pictures to explain to her what we're trying to do, what we're trying to accomplish. She felt very comfortable with everything that we discussed. And that's actually part of the most important thing, is to have a good rapport between the surgeon and the patient, and for the patient to be very comfortable with what we're going to be doing. I saw Amal on her recovery post-op day 1. After that, at a week, she was healing very well. We took out the splint, and she felt very good. Her breathing was much better, and she was back to singing within the first month.